Good morning, and thank you, Rod, very much for inviting me. It's fantastic to be here and present. My daughter-in-law was featured in this article around Australia with the launch of Defeat Diabetes. She's had type 2 diabetes for a few years, and she's gone low carb, and as it says, she's been able to decrease her HbA1c from the 8s down to 5.9 and lost 12 kilograms. I recruited patients the following way. I looked at patients who had been seeing me just as my regular patients who had type 2 diabetes, and I sort of tried to convince them to go low carb, and I reckon about 2/3 of those agreed. And then I would also get some patients from other GPs in the practice who I would see just because they would see me intermittently, and maybe 1/3 of them would agree. And this was a little blurb that I would say to them. Oops is right. The low-fat, high-carb diet we've tried for the last 20 years has caused your diabetes, blood pressure and heart disease. Oops. Out there, and I explain that it's not accepted by the majority of health professionals, that we're in a minority, 5 to 10% I would guess, but I've certainly found it to work better than anything else, and I get an idea of their interest. And then I explain the basic physiology of glucose metabolism, which probably most of you all are very familiar with. Complex carbs, I mean, we all were taught that complex carbs are the good carbs, and that, because they get broken down a lot slower, but they get broken down to glucose, and it says this on the diabetes website. This is not a secret. The diabetes website also says that this has the biggest impact on your sugar levels. That's not a secret. And then they tell you to go and eat carbs. And then I use some of the infographics by David Unwin, which are just fantastic, and I show them this slide and explain that one bowl of basmati rice is 10 spoons of sugar that sort of gets broken down to, and that's roughly the same as a can of Coke. And you have 2 or 3 eggs, and that's about 0 spoons of sugar. How amazing is that? And I use Peter's wonderful colour chart. Thank you, Peter. And I give those out and give big ticks on the left side and a question mark in the middle and big crosses on the right-hand side. And
Andy shares Dr. Peter Bruckner's chart of all the types of food. Green means great to eat. Yellow means use caution. Red, avoid.
And then I give them some resources. So most of the times I would get an email address and I would send them some links, lots of links. I mean, there's a bucket load of links out there. And in the last few months I've been also referring them to the Defeat Diabetes app. And then I put it into practice. I recommend low-carb changes. A lot of them have had muesli and cereal because we're all, been told how great they are. And, and I say, well, maybe try some eggs and bacon or smoked salmon or whatever you like. I adjust medications according to I won't go through that, but make sure that it's all done safely. Tell them it's now time to have a little bit of salt if you're going low carb. And I generally review them in 1 to 2 weeks, check what they're eating, how they're going, see if they've lost some weight, check their satiety, their hunger. A lot of them ask me what I eat, and I'm quite happy to share it. And I've got some photos on my phone, and so I'll show them what I'm eating because it's good to get visual. So I say nothing for breakfast. Make sure you keep fluids. You've got to keep the kidneys working. And then for lunch, that's when I have a decent amount to eat, and 2 or 3 egg omelette there with some leftover cauliflower from the night before and some leftover chicken. So whatever you sort of have, there's nothing magical about this, just standard sort of stuff. And dinner, protein sort of based dinner, so I might have some chicken livers or some salmon, fantastic, just delicious, and some lamb, some steak, all good stuff, all real food. And then for snacks, I'm still a bit of a chocoholic, so I still like my dark chocolate, and then some other things, nuts. So this is an example of some of the successes that we get. This is a gentleman who saw me. You can see that his HbA1c's, he sort of became pre-diabetic in 2001. His HbA1c went up to 12.7, and that's when I saw him. And we made an intervention at July 2019, started him on metformin, which I think is a really good drug for diabetes, and the low carb. And then 3 months later, his HbA1c is 6.1. That was October 2019, and that's been maintained for 15 months. So we'd say he's in remission. 5.6, 5.8, 6.0 and 5.7. He was pretty happy with that. It's actually been maintained 15 months now. Comparing my low-carb eating to people in the control group. So the inclusion criteria were people who I saw with NIDM, between May and December, and they'd had to have at least 2 HbA1cs performed approximately 12 months apart. 65 patients met the criteria. 32 were in the intervention group, meaning low-carb eating, and 33 were in the control group. So that was nice and even, which was good. These are the results, and you can sort of see the groups are fairly similar. The control group was slightly older. The time they were followed was similar. Their HbA1cs were much the same. At 12 months, the control group had gone up 0.4, which is what it says on the diabetes website. Diabetes is a chronic condition that gets worse, and this is what we see here, a gradual increase in the HbA1c and needing 1.8 medications. I'm pleased to say the intervention group, the low-carb group, improved. You can see that they went down by 0.8, and they're on less medications because we had to stop certain medications, the SGLT2 inhibitors and the sulfonylureas usually. So they're on less medication, and I think this 1.2 difference is a clinically important difference. Also looked at the number of people in this group who had a non-diabetic HbA1c, meaning a HbA1c less than 6.5, and at the start again very similar numbers. 12 months later it had gone from 7 to 5 in the control group, which I guess is in keeping with what Diabetes Australia tells us, whereas the intervention group had gone from 7 to 11, so that had gone up 34%, which is still better than the control group. And again, I would say that this increase in non-diabetic HbA1cs is a clinically important difference. Now, I shared these results with a colleague of mine, an endocrinologist, and most endocrinologists aren't enthusiastic about low carb, we can say, and that was certainly the response I got. Oh yeah, you can do things that might work for 6 months or 12 months, but most people, it doesn't work down the tracks. So I said, let's see what happens to my patients who are doing this. So again, there are a lot smaller numbers, 25 in the control group, 15 in the intervention group, similar ages, followed for similar times, and certainly their starting HbA1cs were similar. At 2 years, the control group had only gone up 0.3, which I think is pretty good, and their number of anti-diabetic medications 1.9. The intervention group had gone down to 0.8, which we talked about before, but at 2 years it had gone down a smidgen more, 0.9, and they were on less medications. So again, I think this is a clinically important difference, and it's not only maintained but improved over 2 years. I also looked at the patients with non-diabetic HbA1cs, 5 in each group. So again, the control group has a slightly lower percentage, so they're not quite as healthy at the beginning. 2 years later, they actually got an extra 1, which was great. So it went from 20 to 24%, but the intervention group went up from 33 to 57%. Small numbers, I know, but still, they're sort of going in the right direction. And again, on less medications. So again, I think this is a clinically important difference. And achieved with less anti-diabetic medication. I thought, well, this is interesting. They're promoting this medication. It certainly works well. A drop of 1.5% is pretty good. But one of the things I noticed in the graph is that 30 weeks it seems to be at its lowest, and then the HbA1c seem to be rising for both medications, yeah? And I thought, well, that's interesting, which is exactly what my endocrinology friend said happens. There's no complaints about this. This is just what we expect. And the other thing that was interesting is that 20% discontinued treatment. One of the big criticisms of low carb is, but people don't stick on it. But 20% of people discontinued treatment, 10% due to adverse effects, and 42% developed gastro side effects, vomiting, nausea, etc., etc. So I thought, well, let's compare that to the low carb groups. And I think this graph looks somewhat better. And they're on less medications. And I should also mention the side effects that happen with low carb. You get less reflux, so you get less distension, less upset stomach. So some real significant side effects with the low carb group as well. Possible issues and biases of the audit. Not a randomised controlled trial, and this means that there's a bias in favour of the intervention, and patients choosing intervention are probably likely to be more motivated, and of course the doctor, that's me, is more motivated for patients choosing the intervention. But I still think it's reasonable to say that for people who are motivated, both the doctor and the patients, dietary carbohydrate restriction can make clinically important differences in HbA1c, number of anti-diabetic medications, and the number of patients with the non-diabetic HbA1c. And these findings are consistent with findings from larger clinical trials. I got an email just this morning from a patient, and I just thought, how lovely is this email? Hi Ron, I went clothes shopping today to a store that I would often struggle to fit into a size 26. Today I bought size 22. I couldn't believe it. I could even get into size 20. I'm so thrilled. Just wanted to share that with you, and thank you for being there for me, for your patience, encouragement and coaching.